So let's talk about some of the themes this week and the information that you would really like to see get across, because I think it's relatively new, isn't it? Was last year the first year that we celebrated it?
Yeah, so we've done, I think, Men's Health Week for like 10 or 20 years, right? It's always been around, but we haven't had the same for women's health. So it's exciting to be running this for a second year in a row. And to be talking about this year some of the costs that women incur just from being a woman.
So let's talk about some of those costs then, because again, they could be surprising to some. And I know there's occasionally been a public debate about what items should be made available for women that, especially, again, speaking for the boys this morning, we really maybe don't have a handle on how much of a part of life they really are. So what's come out of the survey?
Well, for us, what we've seen is that, nearly half of Kiwi women expect to spend more than $15,000 on women's health through their lifetime, which is a lot. And 1 in 5 is expecting to spend over $50,000. So there's a huge commitment there to kind of managing healthcare related needs for women. So that's a massive part of it. And also, there are other things as well, there's also cost keeping women from actually accessing care. So about 70% of women have delayed or avoided healthcare appointments because of cost. So cost is playing a major role in how women are making healthcare decisions.
And that's not even the fact that women struggle to get away, to prioritise themselves.
Totally.
Like you've got kids that you're juggling, work that you're juggling, and you're like, I don't actually have time to go and access an appointment right now because I can't fit it into my busy schedule. Then you add the cost as a barrier. And when you talked about that amount, I mean, 15,000 to upwards of, up to 50,000, that's like a nice little car. It's kind of unfair when you think that men don't have to spend that money on boring things like healthcare.
And totally, and obviously we're different, men and women, in terms of our biological makeup, but there are real costs associated with being a woman. And when you think about things like period products, managing pain, bloating, the clothes that you need for pregnancy, like all of these things add up. When a woman goes to a healthcare appointment, what a lot of the feedback we had through the survey is that often they're having to find and juggle their kids at the same time. So whether they have to pay for childcare to actually be able to go to that appointment, whether they have to bring the kids to something that's quite intimate and personal, it's a constant juggle, right? And that's definitely something that affects women more than men.
So looking at the survey and the results that have come out of it too, you've hinted, I think, a little bit about some of the things we can then do to support women in their health. What are some of the results of the survey and maybe some changes that you'd like to see made?
Yeah. Well, I think, when you're talking of things like period products, for example, it would be really lovely to see period products provided for free in like public environments and schools and businesses, etc., because those are real costs that women have. And it's like toilet paper, women need that, and so it shouldn't be something that is added as a toll. And I think if you think about the consequence if they don't have these products, there are girls not going to school because they don't have access to these products. And so, there are women who struggle to go to work if they don't have the right support network in place, if they don't have the right products available to them. So there's real world consequences to actually not having that access and not being able to spend the money, which is quite expensive, on products that are for personal health and personal hygiene.
I actually got to see this firsthand in Tanzania to a different level, where they didn't have what they called a disabled toilet. Now, when we talk about disabled toilets in New Zealand, we think of one that has like ramp access and like rails and like a lot more space. Over there, that's just what we normally use day to day. So the sit down toilet, that's a disabled toilet over there. And the reason why that was so important, that when I was working with World Vision, getting that into schools, is because girls would not go to school for weeks at a time because they couldn't just use the hole in the ground system. They needed a proper toilet with proper sanitary disposal methods, and so that was a huge barrier to girls getting their education over there.
I mean, it's just heartbreaking, isn't it? And I think this is the fundamental of a biological makeup, right, and actually being able to meet the need of women where they are. And, I think also in addition to that, what you see with women is that, a lot of women's health concerns get dismissed or delayed. So what we saw in our survey was almost, 50%, 44% had health concerns that were dismissed, and that was actually disproportionate for Māori women as well. Up to 59%, so almost 60% of Māori women in particular were finding that their needs were dismissed or delayed because of their ethnicity and their gender. And so we need to really kind of lift the lid on this and talk about what are the things that are really impacting our communities.
Well, even being able to talk about period products on a breakfast radio show, I'm thinking like a few decades ago. And it also, if I can put the boys on notice as well, if you still struggle to buy period products for your wife from the supermarket, it's 2025.
I mean, totally.
Thank you, Andrew.
But there is something to be said for like the fact that we still, men and women, struggle to talk about this stuff publicly, even though it affects everyone.
Well, I think I was
Absolutely.
talking about this off air just before we went into this interview about how I'd bought some period products for me and my daughter, and I was telling a friend and I was like whispering, and I'm like, why am I whispering
Yeah.
about this? It's so normal.
It's so normal.
And I think like when you have daughters and stuff, you want their future to be better than, you know, what it was like for you. And so I know that you've got a young daughter. Like,
Yes,
how do you
yeah.
see, or what would you like to see different in the future for your daughter?
Well, this is definitely, so I'm raising a daughter and 2 sons, and for me it's about talking really openly about it. So normalising these conversations with our, in particular my 13-year-old is just entering the teenage years, about the type of man he needs to be to support women in his community and the women around him. So now normalising this, you know, I kind of did a big kind of conversation with him the other day just about, you know, there was a story about a girl who'd kind of got her period on the bus and it was incredibly uncomfortable for her. And like, how do you as a man step up in that scenario? How do you provide support and flank those people in those moments, because it's something that can become a real learning opportunity for everyone involved. So yeah, it's really important that we're not just talking to our girls about it, but that we're talking to our boys about it too.
Yeah.
Because they need to really understand that, you know, women's health is actually all of our health. And so, yeah, super important.
Yeah. So
That's
look,
great
this
wisdom.
week you've got a huge amount of events and other opportunities for people to get involved and maybe improve the state of their health or the health of the women in their lives. So can you tell
Absolutely.
us more about what's happening there?
Well, one of the things that we're doing, which I'm super excited about, is at Tender we're providing free cervical screening across our clinics on Friday. Nationwide. We have
Awesome.
been, which is super exciting. It's probably one of the most important initiatives. But what we saw was that we released all of our slots and they were booked out within hours.
Wow.
And so we've had to get more people in, more slots in to be able to meet the needs of our community. And so that's
Yeah.
probably one of the things that I'm most excited about. And it also tells you that women are not just prioritising their health because they don't have time. It's also because of the fact that they're not able to pay for these services. So really excited about that. But, you know, do something as little as, you know, have a conversation with your friends, with your partner, with your daughter, with your mum about women's health. You know, if you're a woman of my age, have a conversation with your mum about menopause. You know, so like start those conversations in your community. You don't have to attend an event to actually be participating. So we just really want to lift literacy, have those conversations and bring them to the forefront this week.
Great thing to do. And one way that you could do it as well, I see that there is a women's health quiz on your website, which would be a
Totally.
great starting point as well.
Absolutely. And again, for men and women, I'm going to put my husband for this quiz later today to see how he goes. And you're able to win some prizes for that as well, which is fantastic.
Awesome.
Feels like something we should do tomorrow then.
I think
Yeah.
we're definitely going to do it. Well, if you would like to find out more, you can go to the webpage, womenshealthweek.nz. But a big ngā mihi nui. Thank you so much
Thank
to
you.
Cecilia Robinson from 10 Health coming in to chat with us.
Thank you for having me.
Amazing. I hope you enjoyed that as much as we did.
Yeah, don't forget to like and subscribe and turn your notifications on so you don't miss the next video.
We'll see you in the next one.